Hey guys, thanks so much for clicking on my video. Today I wanted to do a video on prednisone dosaging, which is something that I've been kind of hesitant to do, but I promised that I would do this video, and so I wanted to do it. It took me a lot of kind of work and time to get this information put together, and I'll kind of tell you why I was kind of hesitant to do this video in the first place is because prednisone is a very kind of tricky drug. There are lots of variables, which I will get into just in a second. I just want to add a disclaimer too. I'm not a doctor. The information that I'm going to give you in this video is based on what I have asked doctors, what I've researched on my own, what I have experienced myself, and what I have been lucky enough and blessed enough to hear from the testimony of hundreds of people on prednisone. I kid you not, hundreds of people that have given me the honor of reading their experiences on prednisone, and so that's where most of this or all of this information is coming from. So I just wanted to put that out. Second of all, when it comes to prednisone dosaging, the information that I'm going to give you is very generalized because of the variables of prednisone. Variables include your size, how long you've been on it, if you're sensitive to medications, if you happen to be sensitive to prednisone. So there are lots of different things that can affect the side effects of prednisone and at what point you see the side effects of prednisone. So the information that I'm going to give you is general information that it seems the majority of people see certain symptoms at certain milligrams. And so that's what I'm going to share with you today. So first I wanted to just cover I'm going to start low and go up, and I'm also going to talk to you a little bit about tapering as well. So a low dose of prednisone is considered anywhere between like 0.5 milligrams, which literally is a tiny, tiny dose, to up to 7.5 milligrams. And that is because your body actually makes a natural hormone that is very similar to prednisone. Most of you have probably heard it called cortisol. And cortisol is the body's natural sort of checks and balances sort of thing for the immune system. The immune system does its job. Cortisol's job is to make sure the immune system stays chill when it needs to be chill, and doesn't let it get too out of control. So that's what cortisol does. The adrenal glands make cortisol, and they produce roughly 7.5 milligrams a day of cortisol, which translate to roughly 7.5 milligrams of prednisone. Some people are give or take a few. Like some people naturally produce around 5, some people naturally produce around 10, but generally it's 7.5 milligrams. So when you are taking prednisone at anywhere between 0.5 milligrams to 7.5 milligrams, your adrenal glands are still producing that cortisol to some extent, and so you're not getting oversaturated. Your body isn't getting saturated with all of this hormone, all of this prednisone. So it's a pretty low dose, and I have personally been on low doses like that for many years and had very almost non-existent symptoms. I'm not very sensitive to prednisone. I think I'm kind of like right in the middle of the road. And so at 7.5 milligrams, 5 to 7.5 milligrams, what you might see is a little bit of trouble sleeping, especially if you take it right before bed, which I think most doctors say will tell you to take it in the morning, because that's when your body naturally kind of goes into the swing. It just works better in the morning. It also keeps you from staying up later at night, because prednisone can make you kind of jittery and stuff like that. So some people do have some problems with sleeping. that, or maybe some slight moodiness at times, but that is still, it's just pretty rare to notice prednisone side effects at that low of a dose, even if you have been on it long term. So now we're going to talk about medium doses. Also, actually, I guess I should go back and tell you that the only thing that's bad about 7.5 milligrams and below, and it's actually a little bit higher than that, is that to taper, to get completely off of prednisone at those doses, you have to go super, super slow, because if at some point you were taking a higher dose of prednisone and going down, your adrenal glands might have stopped taking that cortisol. So once you get down low enough, then your body is understanding that there's not enough prednisone, cortisol in your body. And so the adrenal glands kind of takes a minute for your adrenal glands to realize that they need to start making it and to actually be able to produce it again. So going down off of prednisone, tapering down from prednisone at such low doses, doctors typically do it very slowly, like 0.5 milligrams, sometimes a week or longer, to taper down from. So it can be tricky. Unfortunately, sometimes some people never get completely off of prednisone at those low dosages. Unfortunately, that's just sometimes the way the body works. Most of the time, I would say that's probably not what happens. I've gone on and off of prednisone and long-term prednisone many times, and I've always been able to come off, but there are some instances where you can't. So the medium dose is anything above 7.5 to about 20. Some people, sorry, my camera glitch there. Some people still don't really notice many symptoms from that, but it is a medium dose, so some of the side effects may include a little bit of bloating, maybe some weight gain, probably not that much, not at all like what you'll hear from some people on prednisone. Probably get a little emotional at times. This is when people start seeing more problems sleeping. Some people have some skin problems, like acne can start up at those times. So, and of course, anything above 7.5 is your body is starting to not produce that cortisol anymore. So, so that's sort of what to expect up to 20 milligrams of prednisone. It's considered a medium dose. I've even been on that dose for like longer term and been fine. I'm a smaller person. I only weigh about 100 pounds. So I would guess that if you're even a larger person, that your body would not be affected by it quite as much. If you are a child, you might be affected by it even more, and you might see some more of the side effects that you would see at higher dosages. This is just kind of general, like I said. So up to 20, pretty medium. You probably will see very minimal symptoms, but you probably will see maybe at least a few of those, I would say. I certainly remember feeling pretty emotional and having a bloaty sensation, even though a lot of people around me couldn't tell. I felt it, like I felt like my body just didn't quite feel right. I felt a little puffy, but it wasn't super noticeable even to myself, and it certainly wasn't very noticeable to anybody else. So now we'll talk about kind of higher doses. And I consider higher doses of anything above 30 milligrams, like 30 milligrams and above. A lot of people experience the much more difficult symptoms of prednisone or side effects of prednisone at those higher doses. And that can range anywhere from 30 milligrams to 100 milligrams daily. Obviously, if you're only on 30 milligrams, you're not going to have nearly the side effects of 100 milligrams daily. But if you are on 30 milligrams daily long term, and that's longer than, a couple weeks, then you might start to see some of those more, you'll start to see those side effects start piling up, which is, some weight gain, some bloatiness, acne, might have some hair growth. Like women might see hair growth on their face and maybe a little bit more on their arms. Even maybe in the back, they might have increased hunger. Um, Certain things like that. You might see a little bloating in the face. A lot of people know this if you've been on prednisone as like the moon face, which I absolutely hate using that because I feel like that is like the worst. Like nobody wants to say that they've got a moon face. I just feel like that's kind of derogatory. But anyway, um, that is when you might start seeing some of those side effects. Some people see it kind of stronger on 30 milligrams. Um, when you get up to towards 60 milligrams, unfortunately, you can see a lot of problems from that. And that is when your doctor should be, especially if you are on 60 milligrams for a long term, your doctor is really going to be monitoring different aspects of your body because unfortunately, prednisone can affect your entire body. There's so many aspects of your body. So at 60 milligrams for a long term, I could list out all of the side effects, and here are some of the ones that people are frustrated with the most, I think. And that's like the moon face, bloating in your stomach and in the back of your neck. It's called buffalo hump. Also not very attractive, um, I don't know, word for it, but I get that. Some people experience a lot of edema, which is like swelling in their legs and maybe even in their hands. A lot of people will have a lot of emotional issues on prednisone at that high of a dose, depression, and a lot of jittery, kind of anxiety feeling, a lot of trouble sleeping. Can have acne, definitely growth in hair. Unfortunately, you can even have loss of hair on your head. Um, and that's just to name a few. And unfortunately, too, on 60 milligrams and above, 50, 60 milligrams and above, your doctor also should be monitoring you for other complications that your body can have that you can't get rid of just by coming off of the prednisone. It should definitely be noted that the side effects of prednisone, almost nearly all of them, except for the ones I'm about to tell you, will absolutely go away when you come off of prednisone. It takes time, especially depending on how long you've been on prednisone. If you've been on prednisone for months at a higher dose, then it's definitely going to take your body time for the prednisone to start coming out of your system and for your body to go back to how it was. If I could show you a picture, I don't have many pictures of times when I've been on really high doses of prednisone. I'm a very kind of small person in general, but I was bigger on prednisone and I did not look the way I look now. I'm very lucky to not have to be taking prednisone right now, but as you can hopefully see, all of the side effects have gone away from me. I do not have lingering side effects. The few side effects that I will tell you about, though, are for people that have been on prednisone long term. And that can be hypertension, which is high blood pressure, something that can be a complication pre-diabetic and even diabetes because the blood sugar can go really high. You can get glaucoma, so it's very important to be tested, your eyes to be tested by an ophthalmologist with a dilated exam at least every 6 months when you're on prednisone. Also, it can speed up the process of getting cataracts, so you definitely need to be checked for that as well. There's a lot of bone issues that people can have on prednisone the one side effect of prednisone that I have that has never gone away because I had such extended long-term high doses of prednisone is brittle bones. I have osteopenia, which is the earlier stages of osteoporosis. And so I've been on treatments to kind of build up the bone again and to try and preserve its health. But you can have problems with your bones that you can't really reverse. So some people even have osteoporosis um, and a lot of muscle weakness and muscle problems. Um, so those are more long-term things that coming off prednisone won't necessarily make it go away. Like cataracts is a very simple procedure to take the cataracts out and put a new lens in, but unfortunately, once it's there, and you can't take it back. So, so I hate to leave off on 60 milligrams. So I'm going to tell you a little bit, or 60 or more, but I'm going to tell you about what the tapering process kind of looks like at those higher doses going down. Fortunately enough, on those higher doses, once your immune system is under control, your doctor can usually start tapering you pretty fast from 60 milligrams or higher, because at that point, your body is very saturated in the steroid, and so it's not going to sense so much of a problem when the steroid is kind of coming out of your system. If your illness is still active, then that might be an indication that you need to stay on it longer if you start having symptoms when you're coming down at such a high point. I've had to jump back on it when I was down to like 20 milligrams, unfortunately, which is still something that you most of the time you can taper lower pretty quicker, even on 20 milligrams. But a lot of doctors can taper down 5 milligrams a week, starting at some of these higher doses. Some doctors, depending on what it is that you're battling, only put on the really high doses for a couple weeks and then jump down 20 milligrams. Like I've seen people that were put on 80 milligrams that jumped down to like 60 and then 40 really quickly, and then tapered 5 or 10 milligrams every week after. And for some people that works very well, so you can really start tapering pretty fast from high amounts. It should also be noted absolutely that you cannot just jump off of prednisone, because like I said, your body isn't making that cortisol and that prednisone, that natural steroid that you need to function in life. So extremely important. You can have very, very severe symptoms called Addison's crisis if you jump off of prednisone, if you've been on it for so long. So it's very important to stay with your tapering schedule, but it is good to be honest with your doctor and just letting him or her know that you feel like your body can handle certain things, and so if you would like to try, but try not to take matters into your own hands to taper off yourself. At lower milligrams, I'm going to show you or try to talk to you about when you start seeing some of these symptoms go away. A lot of people really want to know, specifically with moon phase, when that side effect starts to taper off. And in my opinion, it has been anything 15 milligrams or under. Certainly once I get to 12.5 milligrams. But for people that have been on really high doses for a long time and they're tapering slowly, as you go down to 25, 20 milligrams, you will start to see a change in the way your face looks and the way your body looks. So your body is starting to get rid of that from your system. So it does taper. It might be very slowly, but it will taper. But once you get down to 15, 12.5, certainly 10 milligrams, you'll really start to see those side effects really start diminishing. And that's oftentimes very, very encouraging for people who just, of course, most people, almost everybody just wants to get the heck away from prednisone. So once they really start seeing a difference, it's so very encouraging. I remember so many times going down and just the elation of people commenting to me, oh my gosh, your face looks so much better, or just random things like that, start to see things clearing up. And so it's wonderful. But then, of course, by 7.5, actually anything below 12.5, 10, you have to taper much more slowly. So while you will start seeing a lot of those side effects go away pretty quickly, you'll will still kind of you'll probably still be stuck on prednisone for a little while longer, trying to taper from those lower doses. So I hope that explains some questions or some, helps to explain dosing a little bit better. Like I said, these are really general because everybody's body is different. And so just because something works for me or happens for me doesn't mean it happens for you. Some people have very interesting reactions to prednisone that I've heard of, I've seen that the majority of people don't see at all. So anyway, I hope that answered some questions. If you guys have any other questions you'd like me to try and answer about dosing or anything else, please feel free to comment here or message me. This has been an incredibly long video. I'm so sorry about that. So I will check off now, and thank you guys so much for watching my video again. And again, if you have any questions, please let me know. So thanks so much for watching, you guys. Bye.